Hi, my name is Eric and I'm going to be the nurse.
I'm Nasia, I'm going to be the patient.
And I'm Brianna, I'm going to be the recorder.
Alright, so when I very first entered the patient's room, I'm going to try privacy and comfort as needed. I will perform hand hygiene, and we have already gone over the patient's chart outside of the room, and we've already done her height, weight, and BMI, and all that looked good. So, hi Nasia.
Hi.
Nice to meet you. My name is Eric. I'm going to be your nurse today.
Okay,
How are you doing?
good. How are you?
I'm doing good, thanks for asking. So I'm just going to be talking to you about some assessment questions and stuff, but before we get to that, I'm going to have you verify your name and date of birth. Full name, please.
Nasia Waldrick, 427.99.
Okay, and then in a hospital or clinical setting, if this was a facility that had to use bracelets, I would scan her bracelet now to double, triple verify. So like I said, we're going to be going over some health assessment questions regarding your head, your neck, your abdomen, which we really want to look at because I think you're in here for a stomach ache today,
Right.
and some nutritional questions, okay?
Okay.
So let's really get to the root of why you came today. You have a stomach ache?
Yes.
Okay, and then I'm going to ask you some more questions about that stomach ache. Can you tell me exactly where in your stomach it is? Can you point for me?
Right over here.
Right,
the
so
bottom.
your lower right area of your stomach?
Yeah.
Okay, and then can you tell me more about the pain itself, about your stomach ache? Can you tell me, is it sharp, stabby? Do you feel any queasiness or nausea or anything?
Queasy and stabby.
Queasy and stabby, okay. Now let's try to zone in on more about that pain. Can you tell me what your pain level is on a scale of 1 to 10? 10 being the worst possible pain you could ever feel.
A 7.
A 7 out of 10. Okay, that's a pretty serious stomach ache. We're going to have to do some more information, gather some more information, I should say, to see what we can do about that, okay? And then I don't know if I mentioned this, and I apologize if I didn't, but just so you know, this should only take 10 to 15 minutes, okay?
Okay.
Total, so I'm not going to have too much of your time here.
Okay.
So, more about that stomach ache. Have you taken anything for it?
Just some Pepto-Bismol.
Some Pepto-Bismol, okay. And did you take anything else or just that?
I took just that.
Okay, and has anything at all that you've done made it worse?
No, it hasn't.
Okay, all right, well, we can work with that. I'm going to ask you a couple more questions, and it's going to be involving your medication usage, okay?
Okay.
Do you take any other vitamins, over-the-counters, prescriptions, supplements at all besides the Pepto-Bismol?
No, just the Pepto-Bismol.
Okay, no, that's okay. Just wanted to make sure because you never know if any medications can, interact with each other and stuff and cause problems. I'm going to ask you some nutritional questions now, okay?
Okay.
Would you say that you, at home, do you usually cook for yourself or does somebody cook for you?
I usually will cook for myself.
Okay. Do you eat out a lot? Do you eat a lot of processed foods or high-fat foods?
I eat fast food a lot. More
A
than I
lot?
should.
Well, maybe, I'm not saying, but maybe that could be a part of your stomach ache, but we're going to really let the doctor decide that later on.
Okay.
I would really focus on eating your proteins, your healthy fats, your fruits and your vegetables. Do you eat any of that?
Yes, I try to daily.
Okay. I know it's hard, especially you're in school, right?
Yes,
I know it can be hard too when you're in
Very
school
stressful.
to cook every single day.
Yeah.
I understand that. Okay, so now I'm going to ask you some even more personal questions. Is that okay?
Okay.
Okay, it involves your bowel movements and your urine. On your bowel movements, have you noticed any recent changes, especially a few days leading up to your stomach ache? Have you had any diarrhea, any changes in color, consistency, or your routine of, when you usually have a bowel movement?
I've just had some diarrhea since yesterday.
Okay, well, we'll also add that to our list of things we're going to look into. I don't know if the doctor is going to order a stool culture or not. That's going to be up to him. I'm just going to pass all that to him. So just letting you know.
Okay.
And then your urine. Have you been regular with your urine flow?
Yes.
Any pain or changes or anything?
Nope, don't think so.
Okay, great. So now, if it's okay with you, we're gonna go ahead and move on to a physical assessment, okay?
Okay.
So I'm gonna have to be touching you, so I'm gonna put some gloves on, okay?
Okay. You want me to take off my glasses?
That would be very nice. Let me put these gloves on, and then I will grab them from you. These gloves are too big, but we're just gonna roll with it. Okay, so, I'll put your glasses over here for you. Okay, so I'm gonna be starting with your head, okay? I'm gonna be
Okay.
starting with your scalp. I'm gonna have to palpate and touch it to see how we're doing.
Okay.
And while I'm doing this, you let me know if you have any pain or tenderness, okay?
Perfect.
Okay, ready?
Mhm.
Okay. Is any of that hurting?
Nope.
Okay, how about here?
Nope.
Here?
Nope.
In your ears, any pain or tenderness?
No.
Okay, in your ears, I would have a pen light. I'm looking in ears, they're looking good. Very nice. Okay, I'm going to be touching your forehead now, okay?
Okay.
Any pain or tenderness?
No.
Okay, I'm just checking out your sinuses here. And then now I'm going to check this sinus. Any pain or tenderness?
No.
Okay, and then if I do this, can you still breathe
Yes.
out of this nostril?
Yes.
And how about that nostril?
Yep.
Okay, very nice. Now I'm going to be palpating your jaw, but before I do that, I just want you to know your eyes are looking nice and healthy. They're symmetrical on your face, so is your nose. It's lined up really good with your mouth, the curvature and all that, so that's all good. Okay, so now I'm going to be touching around your jawbone here. Any pain or tenderness?
No.
Okay, so now I'm going to hold my fingers right here, and I'm going to have you open and close your mouth. Any pain or tenderness?
No.
That's good. And I didn't hear any clicking either, so we're good there. Now I'm going to move on to your neck, okay?
Okay.
You look up just a little bit. Thank you. And again, let me know if you feel any pain or tenderness. Anything?
Nope.
Okay.
Looks all good.
How about now?
No.
Thyroid and all that stuff's looking good. So now I'm going to have you do, and you don't have to do this fast or whip your head around or anything like that, okay?
Okay.
I'm going to have you move your head to the left and to the right. Pain?
Nope.
Okay, now up and down. No, any pain?
No pain.
Okay, that's good. So now what I'm going to do, if it's okay with you, I'm going to put your bed down a little bit.
Okay.
If I can figure out how to work it. Okay, so if at any point you tell me that you're uncomfortable or that this is a bad angle for you, and I'll work with you, okay?
Okay.
That should be good right there. Is that okay with you?
Perfect.
Okay, so for, you know what? I apologize. I forgot something. I need to look in your mouth. May I put you back up real quick?
Sure.
Okay, I am so sorry.
It's fine.
It's one of those days. I woke up early. That's all my fault. Thank you for being nice about that.
No problem.
So I'm just going to look in your mouth real quick, okay?
Okay.
And then, in a clinical setting, I would have a pen light and a tongue depressor as well to assess her back of her neck and her tonsils. So real quick, I'm going to have you open your mouth for me as wide as you can. Okay, pen light. Do you brush and floss and use mouthwash daily?
Mm-hmm.
Do you go see a dentist at least once a year?
Mhm.
Very good. Okay, your gums are looking good. And your teeth are looking good. And go, ah. Okay, back and throat looks good. Okay, I'm sorry. I didn't mean to do that to you.
It's fine.
But everything looks good. Nice and healthy. Now I'm putting you back down.
Okay.
Okay, so again, clinical setting, we would be still providing privacy, but I would be moving her shirt up just a little bit to have an area to work with her abdomen. Just so you know, I'm working on your abdomen now. But I'm not going to do that. And since she states that she's having some tenderness in that lower, or some pain, queasiness in that lower right quadrant, I'm going to, when I palpate softly, I'm going to palpate that last. So I'm going to begin by listening to your stomach, okay?
Okay.
Did I put this in right? No, I did not. Okay, I'm sorry.
It's fine.
All right, so I'm going to be listening to your tummy. I'm going to be starting here. I'm going to be nice and gentle, and I'm going to be working my way through all 4 parts of your stomach, one at a time, okay?
Cool.
in a clockwise fashion. Okay? And I'm listening for bowel sounds and for any stomach disturbances. And when you're oscillating the stomach area, you're listening for at least 3 to 5 minutes per quadrant, and at least 5 minutes before charting no bowel sounds and documentation. So the only thing I'm noticing on listening to your tummy is that lower right quadrant. I'm hearing a little bit of upset tummy noises. So that's another verification of the way you're feeling. Some more information I could pass along to the doctor, okay?
Okay.
So now I'm going to be just doing some light finger palpations, okay? And if you feel any pain or tenderness, you stop me. And again, I'll do your bad part of your tummy last, okay?
Okay.
Okay, ready?
Yeah.
All right, palpating. Pain or tenderness?
Nope.
Okay. And pain or tenderness?
Nope.
All right, there, a little pain and tenderness?
Yes.
Okay, yeah, that's our problem area. That's okay. It didn't sound too out of control or anything, so
Okay.
at this point, if I need to do a pubic assessment, I'd be assessing that and her abdomen visually for any abnormalities or discolorations or pain or anything like that. Okay, so I think I'm done with that assessment part. Would you like me to put your head back up?
Yes, please.
Okay, I'm going to put your head back up. I will. Hold on, let me put this up all the way. Where you want it, I should say.
That's good.
That's good? Okay.
Yeah.
I'm going to be passing along what we went over today with your doctor to see what he wants to do, and pretend that's a trash. And he'll get back to you very soon. He'll be in to check with you to see what we want to do to follow up to really get that tummy taken care of.
Okay.
Do you need anything else before I go?
No, I think that'll be all.
Okay, wonderful. Again, let us know if you need anything. You have your call light. Is your bed the way you want it?
Yep.
Okay. I see that you have a tape marker on the back of your wall to keep the head of your bed, well, I should say your bed level with that mark. So I'm going to leave it there. And I'm going to perform hand hygiene, leave the room. Do you want me to close this for you?
Yes.